Right, 21 minutes after 7 o'clock. This is ENCA, the South African Morning. Hello, I'm Gareth Edwards. Now, the length of time that people are experiencing COVID-19 symptoms seems to vary greatly from person to person. Well, a study from the Centre for Disease Control and Prevention has published an advisory for people who are suffering prolonged COVID-19 symptoms. It's called LongCOVID, or COVID long haulers. Now, to understand the condition and what you should look out for, I'm joined by Professor Lucille Blumberg from the National Institute for Communicable Diseases. Prof, good morning to you. It was a question a lot of people were asking when we first started hearing about COVID-19. How long does it last? It seems it's even more grey now than it was before. Why is that, do you think?
So, good morning, Gareth. Well, I think, that's quite a new disease. We've only had experience of COVID for the last 8 to 10 months. So I think we're still learning. But long COVID, although there's no international consensus definition, would refer to the persistence of symptoms generally beyond 28 days. And some people may even experience new symptoms in this period after 28 days.
And I imagine, Professor, it's actually quite difficult for someone to gauge this, because if you've had COVID and you've then recovered, you've perhaps gone back for another test, but a few days later you start having a bit of a cough. It might just be a cough, unrelated to COVID-19. So how would people know that they're potentially a COVID long hauler? It's a great name. How would you know if you're a COVID long hauler? What do you look for?
So it's really the time period is important. So it's not just shortly after recovery from the acute disease. I think some people refer to 21 days as a cutoff, and symptoms that persist beyond that or develop new would be classified as a long hauler. I think we're taking 28 days as our cutoff. And it is difficult. The symptoms may wax and wane. They can remit, they can relapse, and they're very similar to, in many cases, the same as COVID, but it's that time period. So fatigue is very common with long COVID, headache, loss of smell, anosmia, shortness of breath, myalgia, memory issues, and then quite a lot of mental health issues, depression, anxiety, what many people refer to as brain fog. Can't think as clearly as they used to.
So just help me understand, as far as a global number is concerned, if you do have it, Professor, just how prevalent is long COVID or COVID long haulers? Are we starting to talk about a significant number of people who have COVID-19 who become long haulers, or is this number still low enough for it not to be too much of a concern right now?
Well, we don't know the actual percentage. Probably in the region of about 10% of people who've had COVID will go on to develop long COVID. But the good news is that the symptoms will decrease with time, and the overwhelming majority will get better in the following months.
Well, that is incredibly good news, even though it's called COVID long haulers. Professor Lucille Blumberg, I'm going to say thank you to you for joining us this morning here on ENCA, National Institute